We are the representatives of European industry. The Commission will come to us to ask for solutions, and what we do is we in turn go to our national network of member companies and to the more European-based corporate members, and we bring, through meetings, consultations, we bring the views of our membership together, we make credible arguments, and we bring them to the European Commission to help them make the right decisions. There is a Europeanisation of health. On the legal side, if you look at Article 168 of the European Treaty, or the Treaty of the Functioning of the European Union, to be a bit more technically correct, there we have one article that brings together the health aspects that Europe is responsible for, which are still limited but are expanding. And in more and more and in an increasing level, there's more Europeanisation of health policy, Europeanisation of health legislation, and this will impact every single European citizen. So examples of Europeanisation would be, well, the most topical example at the moment is the cross-border care directive. And this is where citizens are allowed to pass around Europe or pass through Europe and receive the same level of care. So this is a very important piece of legislation, and will have a knock-on effect once it's passed through Council and Parliament, and you will see other policies and other pieces of legislation kind of hooked into this piece of legislation. In particular, one that will come are policies and perhaps legislation in health technology assessment, for example. There'll be, even in the recast of the Medical Devices Directive, there are new powers in this article of a legal nature that will see perhaps new provisions and different types of measures in the Medical Devices Directive that give the Commission a little bit more power to act in certain elements and relying a little less on Member States to have to instigate an action before we have a measure at a European level. We'll see the Commission acting more and more of its own initiative in health.